You are patient enough to go over the basics, strategic enough to deliver a game plan, and passionate enough to care about the performance. But unless you're smart enough to recognise concussion in your players and responsible enough to remove them from the field until they have followed the graduated return to play protocol, then they are at risk of serious injury. Hi, I'm Alan Quinlan and I'm here at the Aviva Stadium in Dublin to talk about your role as a coach in managing and preventing concussion. This venue is somewhat appropriate as many Irish rugby players aspire to one day play here. And while hurdles can stand in the way of this goal, one such hurdle, if not managed correctly, is concussion. The IRFU has put together 4 simple messages as guidelines in the management of concussion. These are: stop, inform, rest, return. This video will detail your role within each of these guidelines so that you will know exactly what to do from the time the player has suspected concussion to the time they return to play. It will then cover coaching strategies to help prevent concussion. First though, let's find out what concussion is, how it can occur, and the signs and symptoms to look for.
Concussion is a traumatic brain injury that affects how the brain functions, resulting from the brain colliding with the inside of the skull. Concussion can be caused by a direct blow to the head or body, and from whiplash-type movements occurring when a player collides with another player or the ground. This injury can take place during training as well as during a match. If not managed correctly, concussion can result in a shortened playing career, a more serious brain injury, permanent neurological impairment, and even death. Children and adolescents are more susceptible to concussion and to developing more serious complications. Children and adolescents can have symptoms that take longer to develop and can take longer to resolve. A player does not need to lose consciousness for concussion to occur. In fact, only 10% of concussions result in loss of consciousness, which is why understanding the signs and symptoms of concussion is so important. A sign of concussion is something seen by you, while a symptom of concussion is something the player might complain of to you. Signs to look for on the field are: a player lying motionless on the ground, a player who is slow to get up, unsteady, or falling over, a player who is grabbing or clutching their head, a player who has a dazed, blank, or vacant look, a player who is confused or not aware of their surroundings, and a player who is vomiting. Symptoms a player may complain of off the field can be divided into 4 categories. Physical, how the player is. Emotional, how the player feels. Cognitive, how the player thinks. And sleep, how alert the player is. Physically, a player may complain of headache, sickness, balance problems, or dizziness. Emotionally, a player may feel irritable, they may be aggressive, more emotional, or more nervous or anxious. Cognitively, a player may have memory problems, confusion or forgetfulness, or feel slowed down. Sleep-wise, a player may be drowsy, and they may sleep more or less than normal. Symptoms of concussion can come on immediately or up to 48 hours later, meaning players might be at school or work when they experience them.
Now that we know what concussion is, how it is caused, and the signs and symptoms, we can look at your role in the first of the 4 guidelines. Stop. If you recognise a suspected concussion in a player, you must stop them from continuing. If it is safe to do so, the injured player must be removed from the field and not allowed to return. You must assign them to a person of responsibility. For example, an assistant coach, medic, family member, teacher, or teammate. The player must not be left alone or allowed to drive. If you suspect a spinal injury, the player must not be moved and you must call 999 or 112. The next step in the management of concussion is to inform. Inform. You must inform the person who is responsible for the player's care of the suspected concussion. Explain how it happened, inform them that the injured player should be monitored and assessed medically, and advise them of the graduated return to play protocol. Rest. Following a suspected concussion, the player must have appropriate mental and physical rest. The player should avoid playing video games, using mobile phones and computers until symptom-free. They must not train or play in any sports or partake in any physical activity for a minimum of 14 days. Return. You must ensure the player has followed the graduated return to play protocol and should get medical clearance before they are ready to return to play. To explain the graduated return to play protocol, here is rugby coach Noel McNamara.
The graduated return to play protocol involves 6 stages. A player must be symptom-free at each stage in order to progress. If the player complains of any symptoms, they must return to the previous stage. The first stage involves 14 days of complete mental and physical rest. The second stage involves the player undertaking low to moderate intensity activity, such as walking, swimming, or stationary cycling. The duration for this stage for adult players is 1 day, and for junior players between under 6 and under 20s, it is 2 days. If the player is symptom-free during this stage, they can move to the third stage, which involves rugby-specific exercise, such as running drills. This period must not involve any impact activities, and the duration is again 1 day for adults and 2 days for junior players. If the player remains symptom-free, they can move to the fourth stage, involving more complex, non-contact training drills such as passing and catching, and the player can start progressive resistance training. The duration is again 1 day for adults and 2 days for junior players. Following medical clearance, the player can then progress to the fifth stage, involving normal training activities to restore confidence and so that they can be assessed by the coaching staff. The duration for this period is 2 days for both adult and junior players. 24 hours after this stage, and providing they remain symptom-free, the player is ready to return to play. The minimum time of return following the suspected concussive event is no less than 21 days for adults and 23 days for junior players. Bringing a player back before this period is not only putting their life at risk, but will likely lead to a poor performance by that player, meaning no advantage will be gained by your team.
Your role as coach in managing concussion starts well before you suspect a concussion and continues well after a player returns to play. A significant aspect of managing concussion is prevention, and here is Noel McNamara, who will explain the best practice in terms of prevention.
Most concussions occur in the tackle, so understanding and practicing correct technique will increase player safety. When making a tackle, always ensure your head is placed behind or to the side of the ball carrier. Practice correct technique would gradually increase fatigue and intensity, so you can safely progress from the training field to the playing field. As well as tackle technique, you can minimize the instance of concussion by knowing and teaching the laws of the game, by ensuring optimal fitness in your players, and by never letting players return to train or play until they have completed the rest and return protocol.
To recap, concussion is a brain injury caused by contact to the head or body, or whiplash injuries. Concussion can lead to permanent loss of mental function and even death. Signs and symptoms are observed on and off the field and can occur up to 48 hours after a concussive event. If you suspect a concussion, your player must be removed from the field immediately. You must hand them over to a person of responsibility, and they must not be allowed to return until they have completed a GRTP protocol. Bringing players back early not only endangers their lives, but will lead to poor performance. Coaches play a major role in the prevention of concussion. Finally, as a coach, you are an influential figure in the eyes of your player. If you pass on the information contained in this video and emphasize the importance of managing concussion safely, you will help change the culture of concussion and ensure the safety of your players. For more information on concussion, including videos for junior and senior players, family members and referees, go to irishrugby.ie. If you would like to attend a Safe Rugby course to learn practical rugby-specific first aid, or if you have any questions regarding concussion, go to irishrugby.ie and search SAFE. You can email saferugby@irishrugby.ie or call 086 021 6064. And remember,
Stop.
Inform. Rest.
Return.